either dust or raycast. Definitely having to go through IT to add an external user to a specific Slack channel. It wasn't a bug, but when the electricity shut down in Spain and Portugal, terrifying moments. I want to say mix, but I'm in the office a lot, so office, except during the summer, and mix. Hard feedback delivered softly. Async. I'm Paloma, I'm 29 years old. I live in Paris, but I was born and raised in Monterrey, Mexico. Before Alan, I was working at another French tech company in operations. And so the move towards Alan in operations was quite obvious and natural for me. Before working at Alan, the company I was in, I was covered by Alan already, so I was familiar with the product and was excited by the thought of working behind it. And I've also always prided myself in working for companies that are mission driven and with values that are aligned to my own. I'm part of the clinic run team. My specific missions are around our mental health offering, so it includes therapy sessions, but also psychological advice through our chats. What it implies in the day-to-day is hiring and onboarding, and also managing the relationship with our freelance health professionals. It's also making sure that all the tools that they're using are working correctly, both for members and for our health professionals, gathering feedback on how we can improve and actually working to implement those improvements and working with the team to adopt those new tools. So I definitely have to say I love digging into issues reported by health professionals or care team members, anyone that has an issue with the clinic in itself. I love looking at the data and understanding besides the impact of the problem, and is it a one-off thing, is there a pattern going on, understanding how many people are impacted, and then based on that deciding on like the next actions, like do we leave it, is it a fire we're willing to let burn, is it something that needs immediate action, and then finding an actual solution. Part of that is identifying, like, is it a systemic issue? Is it something that within our system we built incorrectly? Is it a bug? Or is it an educational issue? And then once I identify that and the solution that goes along with it, that aha moment of being like, okay, this is what I need to do, and actually getting my hands into doing it. Of course, sometimes I need the help of engineers. So in those cases, my favorite moment is when they tell me a fix is going into prod in the next like 5 minutes. And then being able to tell the good news to the health professional. So actually, I'd heard a lot about Alan and the culture, specifically the async written first culture, before I actually applied. And I was actually scared that that meant people would only talk to each other during lunch breaks, and that if you had a question, you needed to look at all the written content that we have. No one was there to answer your questions. And actually, from the interview process, I started realizing how untrue this was. Today, I think one of the things that I like the most about the company and the culture is how willing to help people are. So no matter the size of the question, of course, it's always appreciated that you go look for the answer before. But if you want to dig deeper, if you can't find the answer, people will always be there to help you understand better, learn more, grow as a professional and as a person, an individual. So I really appreciate being surrounded by colleagues that are so willing to help and talk, even though sometimes we talk in person. It's not only async. So it's not my favorite ever, but it is my favorite recent one. It's one I'm proud of. So I identified that there was a difference between the way our one of our partners and we counted our member base, so total amount of people that are covered by Alan. This was obviously impacting the way we were reporting invoicing versus theirs, and payments were not aligned. So I sat down with them and we really dug into, okay, what is your calculation or your way of calculating it, and what is ours? it was really fun because neither one of us, so both of us are, like my point of contact and myself, are more on the operations and partner facing side. So it's not us doing the calculations, yet we managed to figure out how things were calculated on our own and then fix it and pass that on to the teams that we work with, and we ended up saving money on that. So very proud of it.